The arrival of a newborn infant introduces parents to a captivating array of biological wonders, yet few phenomena are as visually striking and neurologically profound as the innate survival mechanisms intricately woven into their fragile bodies. Among these fascinating early behavioral patterns, the Moro reflex stands out prominently as a deeply reassuring indicator of a beautifully developing, highly functional central nervous system. Often colloquially referred to as the startle reflex, this involuntary and automatic physiological response is considered one of the absolute most vital neurological signs that vigilant pediatricians observe during the critical first few months of a child's life. While it may momentarily alarm and distress new parents to witness their peaceful baby suddenly flail their arms wide and burst into tears, medical professionals universally agree that this dramatic reaction is entirely natural and healthy. In fact, this sudden expenditure of energy is a powerful testament to the undeniable reality that the infant's lower brain centers and spinal cord are functioning exactly as perfectly as nature intended. Taking the time to understand the complex mechanics, the fascinating evolutionary history, and the profound neurological implications of the Moro reflex effectively transforms a simple, terrifying startle into a transparent window into the infant's rapidly expanding mind. In clinical and domestic settings alike, the Moro reflex is typically triggered by a sudden, unexpected loss of physical support, an uncomfortably loud noise in the environment, or an abrupt, startling change in the room's ambient lighting. The moment the fragile baby experiences this sudden burst of unexpected sensory input, their tiny body instinctively executes a highly coordinated, remarkably consistent three-part sequential movement pattern. First, the infant rapidly and symmetrically abducts their arms, spreading them wide open into the air while simultaneously extending their delicate fingers and subtly throwing their head backward in a bracing posture. This initial dramatic phase visually resembles a sudden, desperate bracing mechanism, almost as if the disoriented baby is frantically reaching out for a stable anchor in a vast, terrifyingly unpredictable world. Second, the extended arms are swiftly brought back together in a tight, embracing motion directly across the infant's chest, often accompanied by the hands clenching tightly into tiny, anxious fists. Finally, this physically demanding sequence is almost always immediately followed by a sharp, piercing cry, which acts as an evolutionary biological alarm, signaling acute distress and urgently calling for the comforting presence of a primary caregiver. This entire exhausting sequence transpires in a mere matter of seconds, yet it absolutely requires an incredibly intricate symphony of sensory perception, rapid neural transmission, and precise muscular response to be executed flawlessly. When analyzed from a broad evolutionary biology perspective, the Moro reflex is widely believed by anthropologists and scientists to be an ancient, deeply ingrained ancestral survival trait essential for the continuation of our species. In our distant, perilous primate past, helpless infants were carried closely by their mothers through dangerous environments, and a sudden drop or shift in gravitational balance posed an immediate, lethal threat to the infant's survival. The initial wide-reaching spreading of the arms was a desperate, automatic physical attempt to grab onto the fleeing mother's dense fur or body to prevent a fatal fall to the forest floor. The subsequent tight embracing motion ensured the infant clung as securely as physically possible to the mother, restoring safety and preventing separation during frantic, high-speed escapes from predators. Meanwhile, the loud, piercing cry served as an unmistakable long-distance audible alarm, instantly alerting the distracted mother to the baby's extreme peril and prompting immediate retrieval. Although modern human babies comfortably resting in cribs no longer need to physically cling to a mother's fur, this primal, life-saving reflex remains permanently encoded deep within their primitive brainstem architecture. Today, modern pediatricians deliberately elicit the Moro reflex not to test a baby's physical gripping ability, but specifically to critically evaluate the structural integrity and communicative efficiency of the newborn's central nervous system. A highly symmetrical, undeniably strong Moro reflex observed immediately after a challenging birth definitively indicates that the brainstem and the spinal cord are communicating with one another flawlessly and without any internal disruption. It further demonstrates that the baby's peripheral sensory receptors are accurately detecting subtle changes in the surrounding environment, and that the internal motor pathways are entirely capable of executing complex bilateral muscular movements. Conversely, the concerning absence or noticeable asymmetry of this expected reflex serves as a crucial immediate early warning sign for attentive medical professionals looking for hidden birth complications. If the reflex is glaringly missing on only one side of the body, it heavily implies a localized physical injury, such as a fractured collarbone or severe damage to the delicate brachial plexus nerve network sustained during a difficult delivery. A complete, total absence of the Moro reflex in a newborn infant is considered incredibly rare and typically points directly to significant, underlying neurological impairment or severe, life-threatening central nervous system depression requiring immediate intervention. Furthermore, the stubborn persistence of the Moro reflex well beyond its biologically expected, naturally integrated timeline is considered equally informative to developmental specialists monitoring the child's long-term cognitive trajectory. In a perfectly developing, healthy brain, the higher cortical centers gradually mature over time and actively begin to consciously inhibit the automatic, reflexive responses originating from the lower brainstem. The Moro reflex typically reaches its peak intensity during the very first month of life and gracefully begins to fade into obscurity around 2 to 3 months of chronological age as the infant gains more voluntary motor control. By the critical milestone of 4 to 6 months of age, the primitive reflex should be entirely integrated and permanently replaced by mature, consciously controlled voluntary startle responses to environmental stimuli. Ultimately, observing the predictable emergence, the vigorous strength, and the eventual graceful disappearance of the Moro reflex provides parents and doctors alike with a dynamic, profoundly reassuring map of the baby's flawless neurological maturation.